This is an overview of a patient who, as you can see, has severe periodontal disease, pyorrhea, expulsive periodontitis, with some teeth extruded from the socket and extremely mobile. We have atrophy of the upper jaw with a very low maxillary sinus. So here we have just 3 to 4 millimeters of bone depth, as in this area as well. We're talking about the upper jaw. After the examination, I made a plan for 2 pterygoid implants positioned like this, 2 nasal implants positioned like this, obviously 19 millimeters long. So the pterygoid implant, a 10 or 12 millimeter implant, is not a pterygoid implant. It's a tuberal implant in the tuber. In fact, I see quite a few pseudopterygoid implants that are 12 or 13 millimeters long. It's a fake pterygoid that only rests in the tuber. A true pterygoid implant must be at least 19 millimeters long, as we'll see from the post-op X-ray.
Of course.
So the plan was to have the extractions done and temporarily keep these 2 central ones, 2 pterygoids, 2 nasals, and then whatever else in positions 12 and 22. With bone grafting. In this area, I did a lot of bone grafting because we had a vertical bone deficit. Can you turn it off? Sorry. So, as for the mandible, we extracted the lower incisors, placed an implant in the molar area, another in the molar area, and these 2 implants that the patient had done many years ago and that have some bone resorption. I left them in place because at the next checkup I need to perform a lift. What does it mean to do a lift on an implant that has periimplantitis? An implant that has perfect apical osseointegration. Removing it means you have to core out the bone. So what happens? If we already have a bone deficit and we core out the bone here, we end up removing all of the patient's bone.
Of course.
So what did we do? Nothing.
Of course.
In other words, we just kept making things worse for her. So I will treat the threads, decontaminate them, smooth them, remove them, clean all the bone, and do a bone graft with a membrane, and the implant will remain stable.